Wonderful. All right. Hello, everyone, and welcome to the second roundtable of the German-Israeli Health Forum for Artificial Intelligence, hosted by ELNET, the European Leadership Network. For those of you who have not met me before, my name is Carsten. I'm the Executive Director of ELNET here in Germany. It's my pleasure organizing and hosting and representing our organization at this roundtable together with my dear colleagues, Lea, who's the program manager of GIHF-AI, and Hannah Bergman, who is a project coordinator at our innovation team supporting GIHF-AI, and Ginsum, the other innovation project we host. I see already several familiar faces. It's great to see you again, even though it's online today. We'll have another opportunity to meet in person later on this year, and we're going to talk about it here and there during this roundtable for sure at the first annual health conference, at the first annual GIHF-AI conference that we're going to host in Israel end of November. But before we come to that point, just very briefly, most of you already know ELNET as a think tank and network organization that connects experts on several topics between Europe and Israel. And one of our focus areas is innovation, and within innovation, it is the health ecosystem. And we are very proud that last year, the German Federal Ministry of Health asked us to build this program, the German-Israeli Health Forum for Artificial Intelligence, which is a tool to bring the best and leading experts from both countries, so from Israel and Germany, together to discuss policy issues in the area of the digital transformation of the health system, with a particular focus on the application of artificial intelligence. And while we publish policy papers on our website, usually before events to give some guidance and a certain framework for discussion, usually right afterwards, on our website, we also publish in German and English a report of every event. So that's why this session is on the record. As you see, we're recording it. So the session will also be available on YouTube afterwards in case you want to review it. And so after each event, no matter if it's a roundtable or the annual conference, we also produce reports including political recommendations that will helpfully be useful for both countries, Germany and Israel, to learn from each other, to get a better understanding how to drive innovation, how to drive digitalization in the healthcare system, and how to apply AI for the better. So the second roundtable actually focuses on regulation, in specific regulation of the use of health data in Germany, Israel, and Europe. And just as a reminder, the first roundtable earlier this year was about technology and security. And please have a look again at our website, and maybe Hannah, you can put the link in the chat again for those of you who don't have it at hand. All papers and all reports are published there in German and English, so feel free to review. If you have comments, please reach out to us. If you have more ideas what we should implement in upcoming papers, please just let us know. This roundtable couldn't be more timely in light of the recent visit of Karl Lauterbach, Federal Minister of Health here in Germany, to Israel, where he himself with a team from the ministry and also some journalists got first-hand impressions of the digitalization of the healthcare system in Israel. And from what I heard so far from the ministry, but also from what German media reported, he really was impressed on the one hand and already sees many opportunities, probably even beyond this program, where Germany and Israel can work together, can intensify existing collaborative projects. And this is for us as an organization that connects both countries. It's just marvelous to see the interest from both countries, actually, and see more people traveling. And that's what we're going to do later this year. I already briefly mentioned the first GIHF-AI Health Conference that we are going to host in Israel end of November. And around this policy conference, for the third time, we are planning to bring a delegation of representatives from the healthcare ecosystem, from corporates, from hospitals, from insurance companies, in the context of our second innovation program, which is the German-Israeli network of startups and Mittelstand, short GINSUM. So if you're interested in this delegation going to Israel to learn more, not only around this conference, but also behind, to have a look behind the scenes, to meet more inspiring Israeli tech companies, have a look at our GINSUM website, or just let us know and we can send you more information. So without further ado, I'd like to very briefly introduce our two keynote speakers that we have this afternoon. The first is from Israel, Yoel Ben-Or, the head of policy, digital health. He will give an overview of the status quo in Israel concerning primary, so for healthcare, and secondary, which means for research use of health data. And also in this context, I mean, it's not a surprise for our audience here today that Israel is very much advanced on these topics, is a global leader. We've seen it during the first month and the first year of the global pandemic. So when it comes to COVID vaccination research in Israel, where Israel was a global leader. So again, Yoel, it's a pleasure having you here at the second roundtable. And the second keynote speaker I'd also like to briefly introduce already is Nicole Formica-Schiller, the CEO and co-founder at Pamanicor Health. And also, not to forget about this, she is a member of the board of trustees of the German-Israeli Health Forum for Artificial Intelligence. And as I already mentioned, she just recently wrote an exclusive statement about the proposal for the EHDS, so the European Health Data Space, and its implications for the EU AI Act. And she will present her findings. So, and please feel free again to download the paper on the GIHF-AI website. So, without further ado, I think it is Yoel, at least from my agenda, who has the floor first. You have roughly 15 minutes for your keynote to save some minutes at the end for Q&A. And so why don't you start and take over from here, Yoel?
Thank you very much. And thank you for inviting me. It's a really good opportunity for us to present where we stand, because in the past month here in Israel, we're working very hard to formulate a new regulation for data portability. So I want to take this advantage of the forum to present what are the big questions that we are trying to deal with and where we stand. And I have a short presentation. So if we look at data portability, then the regulation we are working at currently has two layers. One is the technological regulation and trying to implement data exchange standards in Israel. Israel is very lucky to have a lot of digital data, more than 25 years in EHRs in health organization. But the problem is that we started without any enforcement of standards. So we have a lot of data, but a lot of mess in our terminology and data exchange standards. And we currently are working very hard in the past 2 years to try and implement all kinds of incentive programs for health organizations to implement the FHIR standards, the FHIR, Fast Healthcare Interoperability Resource, and the Novamed CT in terms of terminology. But we believe that incentive is not enough. And as regulator, if we want to really see a wide adoption, we need to be very, very precise in the regulation. And we want to really write the standards as an obligation for all health organizations to implement FHIR. So this is the first layer for data portability. And the second, obvious, is data access rights, and especially giving patients the ability to share their data with third parties. So if we look at the goals of this regulation, so I think this is something that will be familiar to you also from the EHDS and other regulations, and we want to speak on proactive personalized care. We believe that these two layers of regulation, the standardization and the patient access to their data, is the only way to make sure that the data will be in the right place at the right time. But it's not just the continuity of care and proactive personalized. If you look at the concept of API economy, Then here in Israel, we are very digitalized in EHRs, in our health organization, but we see that the IT departments that are making miracles, but are becoming a bottleneck for innovation. And then the only way to open up EHRs to innovation that is coming from outside is through APIs, standard APIs that can help other developers to implement innovation into the health system. So these are like maybe the two main goals, but the other are not less important. Patient empowerment, then we believe that patients should be the owners of the data and can decide by themselves also with whom they want to share. We don't believe that they're the only one. We have a lot of information exchange between health organizations without consent of patients, but we do believe that patients should be able to consent and to obligate one health organization to transfer their data to another one. Public trust is obviously connected to this. Competition between HMOs in Israel, the ability to transfer between vendors, and reducing bureaucracy, also very, very important, because a lot of social rights are dependent on health status. And currently, although we are very digitalized, you cannot transmit your health data to the Social Security in Israel and get your rights and transferred more quickly and without bureaucracy. So these are like the main goals. If we see the main risks, then obviously if it's more easier to share data, the risk of data abuse and leakages increases. The increasing of medical legal responsibility. Physicians can no longer say they don't know what other hospital wrote on your EHR. They will know much better what is in your record, and will need to act upon this data. Handling sensitive data that should not be shared with patients via digital channels is a very hard question as well. And the quality of data, I think this is also something that distinguishes this reform between the open banking reform we had currently in Israel. Then unfortunately, if we look at the health system in comparison to the banking, then the data in the health system is not very precise. So there's a lot of mistakes in the EHRs, and giving patients the ability to transfer the data also needs to have a lot of quality checks to see, to detect errors, etc. So these are like the main risks. And from Israel perspective, when we see what's going on in the world, so these are the main two regulatory approaches. One is the US that already put the FHIR standard in regulation and obligating all the vendors and the health organization by the end of the year to be able to transfer their data through a FHIR API. And the European Health Data Space, which was just published, then we were looking at very closely to see what is going on there, because in Israel, we're much more closer to the European approach regarding privacy issues than the US liberal approach. So we're very interested in what's going on in the European health data space. But when my conclusion from what's going on in the world is from the standpoint of Israel, and I think this is something that is relevant to any country, then the question is not if we're going to that direction, but when, because there's an opportunity here to harness innovation from all around the world to tackle our health challenges. And if we move fast and we implement standards in our health system, we can harness this innovation. But there's also a threat here. If we won't move fast, other countries, today we're very digitized, but if you won't go to the FHIR standard and won't give patients their right to transfer the data to third vendors, then innovation will go to other countries. So this is what we're trying to convince here, that although Israel is very digitized, we need to move very fast and very quickly on the data portability and giving patients their rights. So this is like the agenda. The devil is in the details, and I just want to give you very, very briefly two examples on what we're trying to deal with. So the first is how to regulate all of these third parties. So if you look, for example, on Epic Gallery, there's more than 500 applications that currently every health organization working in the US can work with these kinds of applications. But who's regulating these applications? So in the US, the answer is nobody. And I don't think that this liberal approach will work in Israel. I guess that not in Europe also. And if we look at the European health data space, from what I learned, and I would be happy to learn here today more, I'm not sure these applications will be able to work in the ecosystem. It's yet to be seen. And we're trying to think of a third way in Israel, trying to how to regulate these kind of apps. And we're trying to build 2 levels of the regulation. We didn't publish it yet, but we're working on it and trying to distinguish between services that are funded by health insurer or by the government. And then they are required mainly cybersecurity privacy certification done by an independent examiner. So this is like the first level of regulation. The second one is that if it's services that are not funded by health insurer or by the government, then the regulator should have additional examination of maybe there's a conflict of interest between the company and the patient, and it should be more regulation about these kind of vendors. So these are like the 2 main levels. There's a lot of details here about what should be implemented in each level, but we're trying to build these 2 levels of regulation. So this is like one big question of how to regulate this third vendors, third-party applications. The second, and here I get to the relationship between primary and secondary use, then the secondary use regulation in Israel and everywhere else sets rules regarding the ability to use data that was collected for a legitimate primary purpose. So the identification of the data, IRB approval. But there's a big question here that I also didn't find answer in the European health data space, and it's hard for us to find answers as well, is should the data portability allow research use as a primary purpose? Let's say I'm a professor in the academy and I want to ask the permission to collect your data for research only, not for treating you. So on the one hand, why should we prevent such thing? If we will prevent, we're getting to such a weird equilibrium that health organizations are allowed to do secondary use without asking me and without getting my consent. But if I'm giving my consent, they cannot transfer the data to someone who wants to make research. So this is some kind of a weird equilibrium. From the other hand, we're fearing for bypassing the data minimization principle. Like if you are allowed to put in place research as a primary purpose for collecting data, then everyone will just put it as another purpose, and then I will just collect all the data and won't erase it, because it's for research. I can store it and save it for long term. So this can be something that everyone will ask for. And maybe there's also a problem of hurting legitimate commercial interest of data holders. So this is, I think, is a tough question about the relationship between primary and secondary use here. And I'm not sure we have a solution, but one possibility we're thinking of is allowing collecting of data for research, but only for a specific research that was approved by an IRB committee, and not just for any research that will be at the future done by the data holder. So, and this is one thing, and the other is maybe setting the prices for these kind of data requests. So if you're collecting all just for primary use and you will erase the data at the end of the usage, then you can transfer the data without any cost. But if you're trying to collect data and getting the consent of patients to doing research, maybe these kinds of requests should be with a fee that there will be charged by data holders, and the regulator can set the prices. So this is one direction we're thinking of. As I said, I think it's an open question, and we'd love to hear your thoughts. So and I will finish with these questions. So thank you very much.
Toda rabba. Thank you very much, Yoel, for these first impressive insights. It already gives lots of room for questions and hopefully answers. But we'll save it for a little bit later. And as I already introduced Nicole, one thing I'd like to also mention, she's not only a member of the Board of Trustees of GIHF-AI, but also a member of the board of the German AI Association. So really a deep expert in the association business, but also in the industry. Nicole, the floor is yours.
Hello, everybody, and I hope you can all hear me. So it's perfect. Thank you very much. It's my pleasure to be here today and to speak to you about this very important topic. And already we have heard a very great keynote at the beginning. So I will straight away dive into this topic because, as I said, this topic, health data regulation in Europe, Germany, Israel, and health data portability is really very, very important. We all know that no future-proof healthcare system can do without any digitization, without any AI, and without any new innovation. But we also know in particular that for AI, we need data, and we know we need a vast amount of data. And therefore, the topic of the European health data space is a very, very important topic for Europe, but also in the global context. And why I say in a global context, before I come more to the challenges and to the impacts for Germany, for Europe, and for the whole data space, I always want to say that what we talk about here today, it's about health. It's about the most important topic and most sensitive topic. And why I'm saying that, because sometimes we all tend, myself also, to become a little bit too technical on the topic, and we forget what it's about. It's about human beings. And when we talk about health, and COVID has shown this very, very clearly, and I always raised this in different advisory councils before COVID, health is a very interdisciplinary topic. Data, health data, the same. It affects the labor market, geopolitics, economy, and so on and so on. So therefore, we can't take this topic less serious, or we have to take it very, very serious. And the most important point, actually, when we talk about upcoming regulation in general is, and this I always, it's very deep to my heart to always emphasize that, we have all to start with a jointly developed bold vision, where we put on the one hand national perspectives, but on the other hand, we put these national perspectives in a global context. And what we always also need to bear in mind, and this is also a very big issue I always recognize when advising in Europe, it's reflecting on the one hand the past, but the past to create actually today's and tomorrow effective solutions, so that we have sustainable digital health solutions for everybody. Having said that, we come now to the European health data space itself. I mean, many of you already know, so that the European Commission actually not long ago, in May this year. And the general objective of this intervention is actually to establish some rules governing the HDS to ensure a natural person's access and control over their own health data, a very, very important topic, also in the context of trust and transparency. And another very important point of this whole regulation area is that it should improve the functioning of the single market for the development and the use of innovative health products and services, not just with regard to artificial intelligence, but of course also with regard to that. All of this based on health data. And it should ensure that researchers, innovators, policymakers, and regulators can make the most of the available health data for their work, for the health of everybody, while, and this is also a very crucial point, preserving trust and security. And why this is so important, I will come to that later. So we see with this regulation approach that it's all, or not all, but it's a lot about the use of real-world data. And this real-world data would enable actually all of us, healthcare professionals, public authorities, regulators, the industry, and any innovator out there to ensure that our healthcare systems, our products, and our healthcare practice in general meets the patient's need, and that they actually would also lead to favorable health outcomes. And having said that, we all know that data, as I said at the beginning, it's very health data. It's very important, for example, for artificial intelligence. And having said that, when we talk about AI, we all know it's very useful, and it will be a big market already now and in the future for actually understanding health and disease in a way better way. So that means better anticipation of disease outbreaks, also faster prevention and diagnosis, but also the development of more effective preventive measures and treatments. In general, it's planned that by 2025, European member state citizens will have access to their EHR, to their electronic health record, and be able to share them also, with healthcare professionals across EU member state borders. Having said that, and we all know that, this is a big challenge because Europe has a lot of different EU member states, of course. And that means actually in practice, however, that medical records would be needed to be issued in a common exchange format. Interoperability would become a very, very important topic. And health data also, what has been mentioned in the first keynote, more available also for secondary purposes, such as research and innovation, but also for policy making. We all know, and this is a very important point when I am asked about the EHDS, that it comes, of course, with a lot of challenges, with a lot of issues, not just with regard to Germany, but of course, in particular today, also here in this round table with regard to Germany. And there are certain issues which I always hear, which are addressed, and I find this a very valuable point that they are addressed. So one point, for example, one challenge is, in general, the interoperability standards, also the international interoperability standards, they might need to be reviewed and also in some parts established in a quite new way to avoid uncertainty or certain kind of uncertainty and complications also for industry and users. Secure data sharing, big topic. And it's also a big topic when we talk about this. You have to bear in mind that in Germany, it's still, unfortunately, have to say, very often the case that many medical results are still shared by physical paper copies or electronic hard disk copies. And this is far from ideal for many, many reasons. And therefore, we also, when it comes to this digitalization and the EHDS, we have to overcome a lack of trust between users and the lack of interoperability between different health IT systems and applications. And big challenge is the overall governance issue complex. So what I mean with that, and I know we have also maybe some attorneys in the audience, but even if legal is none of your interest at all, why I'm saying this, we always have to see all these upcoming initiatives, governance and regulation approaches from Brussels in a global, in a national, in an interdisciplinary context. So we have seen the GDPR already coming out some years ago, which was perceived within Germany by many to make research a bit more difficult and, a bit like an obstacle and like not favored by everybody. We also have to see that in context, for example, with other regulations, such as the medical device regulation, the EU Data Act, or at the moment, in very high discussion, the EU AI Act, namely the regulation of AI. On this topic, I will not dive in deeper now, given the time. I just want here to bring to your attention that this has to be urgently seen in the context with the European health data space. Because from my perspective, this is one of the most important upcoming regulations in Europe for the next years. And I see in my different appointments in commissions, but also in my daily consulting work at Pamanicor that within Europe, there are major differences as far as the acceptance of AI applications is concerned, in particular when it comes for AI applications with regard to health. And having talked about this AI regulation, here Europe has to be very, very careful that it does not over-regulate, to actually kill, it's a bit of a hard word, but innovation, and more to create a human-centric, trustworthy, and transparent AI. That's why it's very important to see this in a context. Having said that, and having said also earlier, the EHDS offers a lot of opportunities for Germany, for Europe, and one is with regard also, for example, to precision health. We all know that determining a diagnosis, this does not only involve assessing clinical information, but also very crucial, the analysis of data, which is generated by a patient's lifestyle, by biometric data, genetics, and socioeconomics. And here, actually, these precision health models will be underpinned by the EHDS. However, at least from the perspective seen so far from the proposal regulation, the Commission has not sufficiently clarified how such data can be shared in a timely manner with third parties, and also impacting therefore innovation and, for example, the development of new precision medicines. So I'm often asked sometimes when I advise on some things, and funny enough, this question comes a lot from the political area, when I come up with solutions and suggestions. The question is also, will this work? Will this work? Will this be good? Will this work for Europe? And that's very important to say. We all know, in particular in Europe, not one country is like the other. We have seen it with the GDPR. We have seen that countries like within Europe, like for example, Sweden, Estonia, Denmark, they also use the GDPR. They are super digitized, I have to say. And I always say, we don't know until we try. And therefore, this is very, very important. And we have seen in Europe, in Germany, a big step towards digitization in healthcare because of COVID. And we have seen, for example, we have seen this in telemedicine and so on. And I have to say with the EHDS, I'm very positive and I'm very optimistic that this will have a very good, actually, effect on the digitalization of the German healthcare system. Because I have been invited, it was mentioned earlier today, I have been invited at the kickoff event roughly 2 weeks ago by the Health Ministry of Germany. And it was very interesting to see the messages and the key messages and the highlights which have been coming across at that on that day during the speeches. And what was in my mind, or what I remember still, is the notes or the words of the Health Minister, Professor Karl Lauterbach, which is that when we talk in general about data, we need to protect the data, but we also need to use it. And that is really a very crucial point. And for that, he also said we have to approach the things with a certain amount of pragmatism, but also curiosity. And we can't just do this together. And in particular in Germany, the one part of the problem is that Germany has a fragmentation also with different software and standards across the country and across the different federal states, and also the different health providers. Therefore, coming more or less looking at the clock towards the end of the presentation, it's very important that we all are aware that the HDS offers a huge opportunity, but we should also consider and bear in mind some crucial points. And this, given the time, is just a short, some examples, some 3 to 5 points, which I personally find very important. We have to provide strong safeguards for security and privacy when it comes also to the EHDS and to GDPR rules. We have to implement elements of trustworthy frameworks for health data collection, for the access, and for the use. Because at the end of the day, it's also the people, it's the population which needs to feel comfortable and needs to accept what is offered to them. And that is a very important point, the trustworthiness, also when it comes to the health data. We should also encourage data integration into EHRs and health system from consumer devices. This is a very big point, given the fact how much data we actually put out there every day as private people via different wearables, also apps and so on and so on. We need to ensure compliance with interoperability standards across member states. And that is, I see, as one of the biggest challenges, but a challenge is always there to solve, I would say. And we should also not underestimate to consider the fact of integration of certain disease registries, in particular, for example, for rare disease or high priority disease areas. And we should enable the integration of transformative technologies to leverage the HDS, such, for example, digital twins, I mentioned AI earlier, wearables, and so on and so on. If we all bear this in mind, and it's a huge task, I know that, but this could be a unique chance for Europe, because we need to be aware. This would actually represent one of the largest health databases in the world, providing data on over more than 500 million Europeans and a coverage across diverse healthcare systems, which is a big thing. And therefore, in general, I'm convinced that technical innovation, as I said at the beginning, and digital sovereignty are indispensable components of any sustainable and successful healthcare system. But however, or to get there, it needs an efficient alignment, and most importantly, in a timely manner between all stakeholders. I can't repeat that often enough, because based on my experiences, are crucial drivers to push these things effectively forward. And then actually we need to understand disruptive innovation and the progress which comes along with it, and not just manage the status quo. And then actually we are on a good way for a sustainable digital healthcare system. And most importantly, best healthcare outcomes for all involved. So having said that, I thank you very much for your attention. I'm very optimistic that together, as I said, we can tackle these challenges and it will become very successful for Europe, but also in a global context. Thank you very much.
Again, toda rabba. Thank you very much, Nicole, also to you for your insights, your perspective. I find it very fruitful also for the following discussion. By the way, everyone who's with us today, if you have questions or remarks to what the two keynote speakers just said, please just raise your hand or put your question in the chat box, and we can use it for further discussion. Let me start maybe while everyone is thinking about the right and most important question. Obviously, we could start now very basic and discuss what do Israel and Germany have in common, what's different. We tried to give an overview in the very first GIHF-AI policy briefing that we published on our website a while ago. Have a look at that. But while we already chat so much about the EHDS, maybe Yoel, before you, okay, you're just switching on the light. I thought you were running away. Nicole touched upon the EHDS. So from your point of view, what will be or what could and should be the implications in the framework of the EHDS for Israel?
Sure. So one thing that I think is very, very important, we're looking forward to see what will be the end of this legislation process, is what will be the standards. Because currently, if you read the EHDS, the word interoperability you will see it, I don't know, a couple of 100 times written in it, but there's no standards mentioned. And currently, from what my perspective, there's only one standard that is competing on being the global standard. And this is the Fast Healthcare Interoperability Resources, FHIR. And the word FHIR, surprisingly, is not mentioned even in the explanatory notes of the EHDS. So this is something I found very surprisingly. And I think that the standards that the European will go for, if it won't be in a single market, but it will be different standards in different countries, that will be maybe disappointing from the point of view of a small country like Israel, because if you will go to FHIR, it will be much easier to us to convince our health organization that this is the global standard. And we know that the US is going there, and all the big tech, Microsoft, Google, Amazon, they're all going to this standard. So I think this is something that we are very looking forward to see what will be the standards that will evolve from these discussions. So this is one I think, big question. And the other big question, I think, is what will be the approach to players that are not classic health organization or health professionals? Because data portability between two physicians is one thing. Data portability between a physician and Google or Apple is another thing. And Israel is very dependent on privacy perspective Europe has to offer. When we go to our Ministry of Justice, they're asking us, what is Germany doing? What is Europe doing? So I think that the answers that you will give on these questions are very, very important for us.
Very well. Nicole, you stressed that the EHDS will have several positive effects. So looking at potential collaboration between Germany/Europe and Israel, and from what Yoel just said, where do you see the largest opportunities, in particular for our two countries, to collaborate even closer?
Well, I think, as I said earlier, I think there are a lot of opportunities, but first of all, we need to make ourselves aware of the fact that, of course, no country is like the other. Why I'm saying this, sometimes I see approaches like, you go somewhere or hear something and you try to implement it one-to-one. And then people after that are dissatisfied or unhappy if it doesn't work like that. So you need to bear in mind the different national challenges, which you have in the country. I think from what I've learned so far about Israel, I think what Germany can learn from Israel is a lot, and I would say the mindset, because at the end of the day, it's also about the mindset, like let's do it, you know. And they have very much progressed forward with digitalization. We have seen this during the COVID pandemic. So that is a very good point, more like the proactive doing. On the other hand, I think vice versa. On the other hand, as has been said, the legislation issue in Europe, in Germany, this is maybe something which could be interesting for Israel to have a closer look. And the point why I'm saying this, as I said earlier, there are several member states. It's not just one country and one legislation. And Germany has a very complicated and very regulated market when it comes in particular to health, but also how this will be aligned with the other countries to get along successfully on a European level. And I think this is going to be a very important and a very interesting point to watch it. So I think there's a lot of to learn from each other, and also, you know, to actually collaborate with each other, I could imagine.
Very well. I mean, to my understanding, that's also what Minister Lauterbach stressed recently in Israel. It's all about collaboration, and that's also what GIHF-AI as a program is about. And we see many faces from both ministries actually attending this session today. So we see there is a huge interest, huge engagement. So again, the opportunity, if anyone here in the audience has questions or remarks to our two keynote speakers, this is now the chance. Otherwise, we can always pick it up later. If not, Nicole, let me stress again a bit more what you said earlier. You said, in other words, time is ticking. So time matters, obviously, when it comes to regulation, and we see it's all about standardization. We see different standards around the world at the moment. So when it comes to AI regulation, where should Germany together with Israel, or Europe together with Israel, focus in particular on? What are, from your point of view, the most pressing points at the moment?
Well, thank you for raising that question, because it's a very important question. It's a very hot topic at the moment, now going into the fourth quarter. So as everybody of you know, this was launched already in April 21, like from the European Commission. And unfortunately, but not surprisingly, it takes time until this regulation comes to a final solution. Why I'm saying that, just for you to understand the procedure, and I'm a lot involved with that with Brussels, but also with ministries and politicians on a national level. So the proposal came from the Commission, then it went over to the European Parliament and the Council. Already from that side, there were like around 2,000 amendment suggestions, which is quite a lot. And also there have been different compromise suggestions from different states, such as France and Czech Republic, who are heading the respective 6 months tournament within the European Union. So the risk here, and this is actually something what I raised straight from the beginning, is that not too much time should be lost for that regulation. But I want to make also to finalize this regulation. But having said that, I want to make very clear, this is not that I say we have to push for more regulation. As I said earlier, too much regulation can kill innovation. But the crucial points is, and this is a huge debate in Europe, number one, AI definition. There's a huge discussion about the definition of artificial intelligence in this proposal itself. So some member states want a more tighter or more stricter definition. Others actually go to a more broader one. And the second, the most crucial one, is the classification into the high risk classifications. For those of you who are not aware, it's like a pyramid approach the Commission has here. And there's a high risk category. And if you fall with your AI solution into that category, it's very tricky, let's put it like that, for you to develop further innovation. And there's a lot of discussions around that ongoing. And we expect that this topic will progress, in particular now in the fourth quarter. But having said that, we see also here different approaches, sandboxes, and so on from different member states. Summarizing, AI definition, classification as high risk, yes or no. This is crucial drivers, in particular when it also comes to health applications for AI.
Wonderful, thank you. So we'll definitely take that on for the ongoing discussion, also for the panel. Hannah, do we have questions from the chat? You're on mute.
Sorry, now I should be audible. Yes, we do indeed have some questions now. The first one was by Valerie Kirchberger, who asked you, Yoel, whether you can tell us a bit about the mindset in Israel and why you are so much more open towards innovation over there.
Okay, maybe we just read, Yoel, before you jump on it, maybe we read out all three questions, just looking at the time, because I see that Artur also is waiting to take over the moderation for the panel discussion, but I don't want to jump over the questions. So what are the two other ones, Hannah?
Okay, the next question is by Jens Jäger about health data sharing and the fact that everyone has doubts about Germany's ability to set up the required infrastructures and bring about the cultural change in all involved stakeholders. So the question is, what are the thoughts on that? And then we have another question about why the FHIR in Israel is considered the best standard for global usage. Is it because it's used elsewhere in big markets, or are there other advantages?
Very well. I think question 1 and 3 are more to you, Yoel.
Okay, so I'll start with the first question. Well, there are several books written on it, and I'm not an expert on this domain, but I would argue that maybe the one, if I'll need to give one reason, is that we had nothing else to sell. Right, we're a small country with a lot of enemies that are surrounding us. So immigrants without innovation would not survive. So I guess this is something that we should, in generation, not only just Israel, not in the past. If you look historically, the Jewish people had to innovate in order to survive. So this is something that's very rooted in our history. But there are a couple of very good books on this subject. So. I can maybe send you some readings about this. I'm more comfortable with the last question. This is more of my domain. Why FHIR is considered as the standard that we're going to. Then the US has already put the word fire in their regulations. So all the American market is going to the fire standard. And in terms of innovation, this is the main market. So all our wonderful ecosystem of startups that is working in Israel will adjust themselves to fire because they want to work in the US. This is the main, if you're a small startup in Israel, your primary market is US. So they will adjust themselves to fire. And if Israeli health organizations want to remain relevant, to collaborate with startups, they will need to adjust themselves to fire themselves. And another argument is that if you don't believe the US regulator, you don't believe the Israeli regulator, which is much more smaller, I would argue that you need to believe Google, Amazon, Microsoft, Apple, etc., that they are all developing their products in the cloud in the FHIR standard. So there's a famous pledge from 2018 that they're all collaborating via the FHIR standard. It's especially interesting with Apple because usually Apple is working with a closed system and not with an open standard. And in health system, this is the only place they're working with an open standard. The Apple Health that currently is connected to more than 500 organizations is based on the FHIR standard. So if all these big tech giants are going to the FHIR, I would argue that governments should go for that too.
Wonderful, thank you. Nicole, what about German slowiness?
Well, I would not say German is slow. German is in-depth reviewing in detail, and that takes time. So I actually think, the situation is not as bad as it sometimes or quite often you can read in media or in the press. The digital mindset, and that's why I addressed it in my keynote, I think it's really crucial. The crucial part is the digital mindset in Germany. And here I think we have to differ. I think the population itself and many people, they, at least that's what I found out in my research for my book, but also when I talk to other professionals, they are open, they are willing to actually let digitalization in their own health environment, you know, when they go to their GP or when they go to a hospital or whatsoever, because many of them, as correctly has been said, they already say, we use apps, we use wearables, you know, we use apps with sensitive health data, which we put out there where we don't know where it goes. So we would like it to have in a proper environment for the best benefit of our own health. So I think there is a lot of interest. I think the problem is more that people are a little bit getting frustrated because the topic has been dragging for so many years now, and they say, why is not some progressing? And I also have to say, I see so many talented and hardworking people, like in politics, in the ministries and so on, which really want to bring something out on the street, you know, to bring a drive into this whole system. And that's why I said at the beginning, if for Germany, it's really crucial that everybody is now putting previous stuff of the past aside, and that everybody is working together with industry, with politics, policymakers, the people, society, the whole healthcare environment, to pull together and to say, okay, the mindset is there, the willingness is there. And by the way, most importantly, the talent is also there. We see a huge and a vast amount of talent, you know, out there. So why not doing it now? Actually, we have to do it now, because otherwise, and that is also the risk, and that's a given fact, Germany will fall behind. And in several actually disciplines, we already unfortunately know it's not number one anymore.
Wonderful. Again, Nicole, Yoel, thank you so much. Toda rabba, vielen Dank for all your insights, your expertise, taking the time today. Again, please everyone have a look at our website to check out in particular the statement by Nicole on the European Health Data Space, but also our recent policy briefing on regulation. And well, without further ado, it's my pleasure to introduce all of you to Artur Olesch. For those of you who have not had the privilege of speaking with him before, a friend of ours, founder and editor-in-chief at aboutdigitalhealth.com. He will take it from here and introduce our panelists on the following panel and guide the moderation. So I'll just lay back and listen. And Artur, great to have you with us. The floor is yours.
Thank you very much, Carsten, for the invitation. And thank you, Yoel, and thank you, Nicole, for this great two keynotes that give us a lot of food for thought. So as Carsten already mentioned, my name is Artur Olesch. I'm an editor-in-chief of aboutdigitalhealth.com and a digital health journalist. And I'm delighted to moderate the panel discussion where we will try to find concrete solutions and design some recommendations for better primary and secondary data sharing. So we really want to focus on actions needed to move forward from EHD's proposal to legislative solutions and what Germany can learn from Israel in terms of regulatory framework, but not only. Of course, every country is different, but we can learn from each other. So let me introduce the panelists. Before our conference today, I checked the bios and choose one sentence that best describes each of them. And I would like to ask you also to add one more sentence that answers the question, why health-related data sharing is important for you. So let me start with Ronya Rubinstein, co-CEO of Comns. She describes herself as passionate about utilizing medical data for AI that support the triple aim: better outcomes and population health, improved patient experience, lower cost, and improved clinical experience. Ronya, could you tell us a few words about you?
Hi, thank you very much for having me here. I'm so happy to be here and be part of this exciting discussion. It's very important. So in 2 words, me and data sharings, I will say that I used to be on the part of the hospitals being in charge of the data and sharing data, and I crossed the lines to being in the startup side, trying to use the data. So I have the perspective of both sides, and I will even say that I have it both in Israel and in Germany.
Thank you very much, Ronya. Our next guest is Goren, Head of Marketing and Customer Experience at Novamed. Yuri has a strong track record in driving digital transformation, participatory medicine, and the e-patient movement. So, Uri, could you please introduce yourself?
Hi, my name is Yuri. You introduced me quite well, and my interest in data sharing is basically data is what empowers patients. I mean, patients need to be owners of their data, reading from the policy briefings and also knowing the situation in most of the countries. Patients still don't have full access to their own data. It's still held behind walls in hospitals. So before hospitals can share with hospitals, we need to share them with patients. And I think digital health and all these apps and startups, what they bring is empowerment, because you create the data at the patient side, and then the hospital needs to get your data and not you need to choose or to reach out to find your own data in other places. So that's my main point behind this.
Thank you, Uri. We have also Sebastian Vorberg with us. He is specialist lawyer for medical law at Vorberg.Law. He writes about himself, "I'm convinced that a digital medicine can significantly improve health." Sebastian, please introduce yourself.
Yes, hi, thank you. Yeah, I'm Sebastian. Yes, I'm even more radical. I'm a really radical pro data sharing activist, I would say it like this. And the two words I bring up for this is saving lives. There's no reason to keep that back, and everyone who's trying to get it more complicated is probably involved in not saving lives. So I would try to get the other part.
Thank you, Sebastian. And I'm also delighted to welcome Valerie Kirchberger. She's a Chief Medical Officer and co-CEO of Heartbeat Medical. After the presentation of the first assumption of digital health strategy for Germany, she wrote online, "The future is here. We have, in theory at least, all we need to embark on the same journey towards a data-driven and prevention-based system." Valerie, please tell us a few words about yourself.
Yeah. Thank you, Artur. Artur, thank you for this lovely introduction. Yes, I was very inspired by this presentation. I just felt, like it's all there, so let's just do it. But quickly, who am I? My name is Valerie. I'm a pediatrician by training. Like Ronya, I also spent a lot of time, a decade in a hospital in the Charité in Berlin, and now work at a startup. And we focus on enabling the collection of patient-reported outcome measures to assess quality of care. And related to this, what I think about health-related data sharing, I do believe, in the line of what Sebastian, what you said, to not use the health data that we collect is actually unethical. So we really have to do it for the benefit of all of us.
Thank you, Valerie. So before we jump into the discussion with our guests, I would like to set the stage and briefly summarize the statement regulation by Nicole Formica-Schiller, because it gives us an excellent background for the discussion. So let me list what we are missing to make EHDS successful regarding the statement by Nicole. So first of all, we are missing right policies. This is something that we will focus now during our panel discussion. We are missing the intersection of the EHDS with other regulations like the Medical Device Regulation, the EU Data Act, and the Regulation on Artificial Intelligence. Then we are missing some data governance, common standards, including, for example, quality standards for data generated through apps, wearables. We are missing some regulations regarding control over data and data ownership, interoperability, of course, secure data sharing, which is far from ideal for many reasons, coordination of investments. Healthcare models, as they are now, are also problematic because they are focused on treating the disease and quantity of health services instead of quality of health services and health prevention. So the statement mentioned the paradigm shift of healthcare. And finally, citizens' trust. So one of the clear recommendations of the paper is to create new legislation that should specify the elements of a trustworthy framework for data collection. So in the first question to all of the panelists, I would like to draw a big picture of the regulatory landscape. So let's now look at the state of the art. Is secondary and primary use of health data well regulated, or it's rather over-regulated? Is there a danger of over-regulating it? And we know that too much regulation can kill innovation, as Nicole Formica-Schiller mentioned before. And what is the right balance in regulation that allows protecting the data and at the same time using it, as the Federal Minister of Health, Karl Lauterbach, said. So who would like to start?
So I'd like, go ahead.
Everyone, that's good. Okay.
We all have
on.
something to say.
We're a long bunch, I guess.
You start, right?
I'll just start.
Okay.
I would say you said a lot of things are missing. I think the basic thing that is missing is a will. I don't think healthcare still wants to do that. I mean, when you start saying, yes, we're happy to do that, but we need about 13 different laws and regulations. And I think data is power. And as I said in the beginning, when power needs to shift between the system and its patients, and that's what we're seeing, because once the data is free, the power is not in one place. This is where we see those abundance of regulations and complexities. It's about keeping power where it is. It's not about sharing data. I do agree we need to share data in a secure and safe way and help patients. But I think when we overcomplicate it, it's not because it's too complicated. It's because people are worrying about interests and money and other elements which are not, and they are embedding it in this, because when data goes away, power goes away. And just to give you an idea, in the New England Journal of Medicine, it was written in 1976 that patients should own their own data because it will make for better healthcare, for better innovation, and better things. We are almost 5 decades afterwards, and still patients don't have that data. It's not about regulation. 5 decades is enough to regulate everything. And even the technology is there for at least 2 decades. So I would argue it's not about what you said. The second thing I want to say is that innovation is not really waiting for this regulation. I know of many other ways people are sharing data through social media, through sending their printed out test results, from all kinds of other ways to share data for research and to do good. So for me, once there will be a real will, there will be a very easy way, and the investments will follow. Still, it's not there. I mean, everyone's talking about it, but not acting as they talk. So that's my summary about this. And sorry, it's a bit off topic, but I think it answers your questions about priorities and what needs to be done.
Thank you, Uri. Before I switch to Ronya, Sebastian, and Valerie, I would like to ask you about one thing, because you mentioned that we are missing will. So is it, in your opinion, the same case like with telemedicine? Because we know already that telemedicine works for 40 years, 30 years, but we needed a crisis, I mean, a COVID-19 crisis, to realize that telemedicine really brings benefits and really is beneficial for the patient. So is it the same case with data sharing like it is with telemedicine, in your opinion?
In some ways, yes. I think there it was more scaring than willing. It was scary to do medicine in a different way. And I guess COVID became like the biggest clinical trial of telemedicine ever conducted. And now we know where it's good and where it's bad. I mean, it's not fitting for everything, but it does do a lot of good things. And now we know that. So it was like a clinical trial for something that was long before that we knew it should be. I think data will follow telemedicine, because if data is not there, the telemedicine becomes much weaker. So it's kind of hand in hand wrapped, but I think that it's a difference. I think in data, it's more about the power struggle. In telemedicine, it's more about scare.
Okay, thank you very much, Uri. Ronya, please go ahead.
So I can't disagree with Uri, unfortunately. I would love to, but I will say a little bit about the Israeli experience. So regulatory-wise, we could share data for innovation, for research without any problem for years. We have regulation, we have IRBs, we have the ethics committee, we can, the committee can waive consent. The mechanisms were in place. But and data was shared. But when suddenly the magnitudes of data came to the table, it scared us. Okay, and it's not just because of power struggle or whatever. It's also because what does it mean? Just think of all the movies that we have seen when technology takes over or runs foul or all those things. The first thing is that you feel you're a little bit scared of what does it mean? What can we really do? We all know that privacy is a sine qua non, and we have to protect privacy. It's not even a question. We knew it before. We know it now. We need to worry about security. We knew these things, but what can we really do? And we talked about more regulation or less regulation. So the 2018 regulation that the Ministry of Health released in 2018 was actually something that helped hospitals share data in Israel, because it was the Ministry of Health saying from above, share data. We want you to use the data, get it out there. And it was a good thing. And there was new things in the regulation, but most of the really main questions about how to share data, they didn't invent. It wasn't new. We could have done it before. It was that the push forward. This is okay. This is important to do. That was important for the hospitals to be able to do. It's true that it's complicated. It's true that there's a lot of things that hospitals are afraid of. It's true that there are also technical problems. I've seen it both in the Israeli hospitals and in the German hospitals when you don't know where the data is. It's not always digital. It's not, what the format is, how it is saved. There's a lot of work around even accessing the data. So there are a lot of barriers and obstacles. And if I look again and I say Yoel is here, so I must say good things about the Ministry of Health, is that they supported a lot of these processes within the hospitals. So as a startup, I'm saying it's not enough. As someone who wants data to be used and sees the potential in data, it's not enough. Hospitals do need to let go more, in my opinion. But I understand where they are coming from and the obstacles in being able to move on that road.
So in your opinion, regulation is one thing, but the other thing that we need is a kind of strong leadership.
Absolutely. And the funding to help the hospitals, transform. It's a leadership transformation, it's a cultural transformation, but it's also a technological transformation.
And from this point on, we are talking about kind of new mind shift, what is very difficult to achieve, and to change the things that we've been doing for years in the same way. So Valerie, please go ahead.
Yeah, thank you. This has been super interesting already, and I actually very much agree. And as so often in healthcare, and it was also pointed out in this opening of the Federal Ministry of Health on their participatory digitization process, it was pointed out by the guest from Israel, is actually about, again, mindset and culture, and about, like you said, Ronya, about thinking about transformation. It's digital transformation, but it's actually transformation. And what we ask of everybody who participates in the system, it's quite a bit, right? So we're used to treating patients. We have our own data in our hospital, maybe even, on our ward, on our computers. I remember us like having a lot of information on the actual computers there, like downloaded files, things like that, to move ahead into a system where this is shared and where this sharing, where it's obvious what the benefit is. I don't think that has happened yet in Germany, right? So when you say in Israel, the Ministry of Health says data sharing is good because, and then it's explained like, how do we actually benefit? I don't think this has been done enough. And I'm saying this because we actually make the experience at Heartbeat that patients very often, or people, we all will be patients at some point, actually do consent to large amounts to donating that data to research or even other things if they benefit from it, right? So if they understand what is good about it. So in our case, we collect this outcome data. They understand if how they profit directly in an interaction with their physician, but they also understand that other patients with this condition will benefit from it. So they freely give it. It's not even a problem. So I think to answer that question, in our setup, the regulation seems like fine as is, so no more is needed. We actually just need to do what is possible, and very much agree with the before mentioned statements that it's about the why again, like why should data be shared? There should be some understandable use to it. Otherwise, because just as a comment again, I think, and I asked about the Israeli mindset before, Yoel, just because the German one is very deficit oriented often. So we also often focus on problems, it's also valid, but there's also a different way of looking at things where we focus on possibilities and solutions. And if we can do this a little bit, I think this will leap us forward in this topic quite a bit.
So as a startup, you have to convince basically your client to share the data. And do you have some kind of code of conduct for ethical data sharing, or you have your own standards? How does it work?
We have our own standards that are just based on the GDPR. So we ask patients or ask the hospital providers who we work with, whether they allow us to ask patients for consent for us to work with anonymized data, just to build up benchmarking pools within the system that help us to bring forward the system of showing like quality of care and being able to compare your provider to a different one that does the same intervention, like hip implants, for example. And we do that, and there's it's actually that is like legally not a problem at all, and patients consent to a very high rate to it.
I have heard once that data protection is basically only for healthy people. Do you agree with that from your experience?
I mean, I don't know. I think in general in life, in humans, having in German it's a word, it's called Leidensdruck. It means like there's a pressure from suffering that makes you do things. It might be a factor here, but I would state that also healthy people, say if I had an electronic patient record, now I'm considered healthy at this point, I would also donate the data to the EPA, to like an entity that works with it, to the benefit of public health research. So I'm going to say Artur, maybe, but I believe in the good in humans, and I believe that also without this Leidensdruck, people would donate the data. Again, as I said in the beginning, if we understand why, not just for the gain of some major company, or even for the benefit of the Ministry of Health, no, but for like us and our fellow human beings.
Thank you, Valerie. Sebastian, you are the lawyer, so that's the question right for you. What is the right balance in the regulation not to kill the innovation?
Yes, sorry, you will not get a lawyer answer. You will get a personal answer. So I must agree to everything that was said before, and I want to go a bit further. I don't miss any regulation, any. And if I think of the list you just brought up, I'm frightened. I'm very, very frightened of the discussion we're going to have, of all these people coming up and having something to say, not knowing what and why, and we're losing the point of what we really want to do. So what I'm missing is I'm missing making mistakes and learn from mistakes. That's and we have the wrong order in this approach at all. We try to make a regulation before we can act. So the constitutional order should be first act, try something, and then find out what is going wrong. And if something's going wrong, do some regulation, So we have the totally wrong approach. And so if we would just start, go out and stop all discussions, just go out on the beach, nice beach on Tel Aviv or something, and just watch things happening. And then we will find out where the real problems are. And the biggest problem we have, was mentioned before, is the standard. Because we cannot talk to each other if we don't have a standard. So that's the fire standard idea is very, very, very important. And that's more important than any regulation law we're just coming up with. And so I'm sure I cannot help with my opinion, because the culture we just talked about is totally different. So we don't have a regulation problem. I think even that the regulation is coming out there will be very good. I even like the GDPR and everything that's out there. I like that. It's okay. But the people out there are not right. many professionals think already, right? Yes, we need to do this. We have to have this, but then we go out there and we cannot have it. It's 2022 now. So how long we want to wait? If this finished, what we're talking about today, it will be 2050, perhaps, you know? And so I try to get this before I retire, that I will see something of that is really reasonable. But we will have long discussion on that, and I would very be happy. And that's, I think it was Joel who said, we're looking at Germany and how they do it. Don't do that. Don't look at Germany. We're really the worst in making mistakes. We're the worst. We don't like making mistakes, and that's our problem. If we would like making mistakes, and we would see that making mistakes in data security is not that bad as we thought. People are not dying if there's some data out there. Yes, it's not good, and you can be humiliated, whatever, but it's not that bad. So perhaps we should just get on with doing things, making mistakes, learning, and then making regulation.
So, Sebastian, don't you think that, for example, in case of Germany, the healthcare system overall, it works quite well, and therefore there is no urge to implement digital health, no urge to implement data sharing, and no urge for innovations? Is it the case in German healthcare? Because everything is working quite well, so why do we need to innovate?
I don't know. In my mind, I'm always 2 to 5 years in advance, and I see it worked well. And there I see we are in a crisis. We're in a deep healthcare crisis in Germany. We have not enough physicians. We have regions where we don't have any healthcare providing and all that. We have so many problems. We don't have people doing these jobs and all that stuff. And we're focusing even Corona, whatever, and we're just doing what we really need to move a little bit to get to the future. And that won't be not enough. So it doesn't work very well. We are in a crisis already. And the only solution is digitalization and innovation and to push this. And even with our DIGA and that what we have, where we think we were so good, we stopped any innovation because of NDGR, of NDR, of all the other regulations, and every startups to say, okay, yes, please give me something, and how much do I have to pay? And I just want to go into this list of DIGA. And then we have the BfArM said, oh no, you have some problems with your evaluation. We are always discussing and not getting any forward. So I think you shouldn't learn too much from Germany in Israel, but the other way around is pretty good. If we would learn some kind of this way of living and the culture you have just to start things, I think we have many things to start. And then I totally agree. We have very good people here. We have a good knowledge of everything, and we have a good feeling. Just let it all out and just let us do something, you know, and let us make experiment. And yeah, that's what I suggest.
Thank you, Sebastian. So let's not learn from Germany, but from Israel. And this is the question for Ronya and Uri. Israel is one of the world's pioneers in digitalization in healthcare and started to digitize health data already in 1995, if I'm not wrong. So what's the DNA of this success? Can you please give us some examples that could be inspiring for Germany? And I mean here, first of all, the legislative background that allows digital innovations to grow. And of course, we remember that no country is like the other one. So we are looking only for inspirations, and we are looking for kind of lessons learned. So who would like to start? Ronya, Uri?
So I think a lot of the innovation in digitization in Israel was per organization. It took us a while to start to cooperate with one another. We're still learning how to do it. I think this is a big challenge. It's a small country, and the health system is actually, it's not a big system. So a lot of the population half of the population belongs to one health insurance company. And there's two others, basically, another small one. So this allowed the system to implement things, to test out within their own systems. The hospital I was in, also we could do things within our own system because we did develop our own systems. Because when we started, there were not a lot of things out there, right? So I think that was part of the things. If or Yoel before said that we didn't have resources, so we had to use our brains or innovate or that sort of thing. So I think that's part of it. And then the big push that we had from above, I think definitely helped. When I look at where we are today, I think we definitely have challenges. And when we talk about trust, and Nicole mentioned trust and transparency in the health system, I think these are big challenges. During COVID, we had, Sebastian talked about making mistakes. So in December 2020, lockdowns, everybody, COVID was at its height, and the Israeli Prime Minister told us on TV that he has secured vaccines for Israel, and that he's sharing the data, that Israel is sharing the data for better insights around COVID. And the whole country was up in, how can we do that? How can you sell our data? There was a lot of mistrust. And we see the dangers of mistrust when we're looking at people who don't want to get vaccinated. So the trust is a big thing for the health system. And the reason I'm telling you this is that I took a deeper dive into this issue. And we asked people a few questions. We asked them, do you think sharing information is important? And generally people said yes. Do you think that the benefit in sharing information justifies using the secondary information without your consent? And people said, no. Do you agree to using your information without consent? They said, no. And then we asked two other questions. One, we said, do you agree to using your information while we preserve your privacy? And they said, okay. There was more consent. And then we presented a case. We said, okay, your data, anonymized, will be shared for a good purpose of developing a specific technology. The IRB ethics committee will approve it. All these controls around. Now, do you agree? Now we ask the same question again. Do you agree to the use of your data without your consent? 90% said yes. So I think a lot of it is about transparency and about being open about what is being done, both to the community in general and to academics. I think a lot of the mistrust that we are seeing are with people from academia that don't know what's going on and start asking the questions. When we talk about the data sharing around the vaccines, it came from the ethics committee of the Ministry of Health. It came from people that were very happy because they didn't know what was going on. And they said, how come we don't know what's going on? So I think if there's one thing I can say that we learned from our mistakes and we need to get better and that everybody can get better is to increase transparency.
Before I asked Uri, Sebastian, you raised your hand.
Yes, because that comes from the hard work, I think. And I think I wrote that down earlier here. I said, we don't need laws, perhaps not questions, we need campaigns. And this is actually what you just did. You made a transparency campaign to tell people what is good of that. We should do, that's the best thing we could invest in right now, to make campaigns to the people, because even all our patients, they don't want to share their data because they are scared of something that is not out there, and that's what you did. I think it's a very good example, and it's one mistake you've learned from. And perhaps next time you just start with a campaign, why and how you do it, and people will get a yes, please. And if we do that more, we can probably convince much more people than having a good law.
Thank you, Sebastian. Uri.
I'd like to take a different view about this. A lot of the people that answer, we don't want to share our data, then look at their iPhone and open it with their face given to Apple. So I think it's about convenience and utility. I think people will share their data. We share more data than we can even imagine, just to be able to do something fast and easy. So when you theorize about it, everybody wants their data private and secure. No one has, or no one really knows the protocols Google or Apple are using with their credit cards, but we can wave our phone with our credit card and pay, we do it because it's easy. It's like humanity around the early 2000s had a choice between privacy and convenience, and we overwhelmingly choose convenience every time. I think healthcare has not yet made data something that becomes convenient. I think we started with in COVID in a little way, where I needed my COVID my COVID certificate, and within 2 seconds I gave my phone, I gave the permission to go to my EHR, just give me the certificate. No one, I don't think anyone said no. And we gave it to the health ministry, which is kind of weird. Why do you need it? You probably do already have it, right? But you gave that permission in a second, and you basically gave them access to your health records. Why? Because you wanted to fly to Germany or whatever. They needed a COVID certificate. I gave my permission in order to get a COVID certificate. If I would need to do something or get something in that my data allows me to get, I will do it. I do it when I do telemedicine. We do it in all kinds of ways, very easily, very unknowingly. We give our data. We give our data to our insurance company. We give our data to all kinds of people with not really asking about it. But when we see, when you ask us in order to do research for regulation, we say, no, we want our data private. Don't share it with anyone. Come on. It's just about making it really useful. If you find a very useful way for us to use our data, we'll give it to you. We'll share it. We'll do anything because we want the result. When it's very, very theoretical, then we're kind of afraid. Okay? Even the state of Israel gave its data away when there was something to gain from it. It was like a tiebreaker for the vaccine. We gave our data as a nation in some ways, right? We gave our data. Is it only public? Is it the data that they anyway could do? I don't know, and I don't really care, but we got first in line because we gave our data. So it just proves that it's about convenience, necessity, and solving my problems. There is where I'm going to give my data to do that. When it's more theoretical for debating where privacy sits, well, then it becomes very theoretical, and everyone becomes very scared and start to think of all the complications. And I don't think the regulator shouldn't think about the complications, but I think life will get there faster because when data unlocks convenience and solutions, we'll do it.
So Uri and Ronya agreed on that talking about privacy is a little bit too abstract. So we have to offer the stakeholders, I mean, patients, healthcare professionals, some kind of quick gains to convince them to data sharing. And now the question to Sebastian and Valerie.
Let me correct you. I feel the opposite. I think that people agree because they take that their privacy is protected as granted.
Yeah.
I actually think the opposite of Uri. I think privacy is critical.
Of course, yeah. If I have the feeling that the privacy is granted, then at the next step, we are talking about convenience, we are talking about transparency, we are talking about the benefits. So talking about the benefits, the question to Sebastian and Valerie, what are the low-hanging apples in data sharing? I mean, benefits that we can achieve in the German healthcare system.
Should I start, Sebastian?
Yes, please, Valerie.
Many. I'm going to start with like double diagnostics, very obvious, right? In terms of data sharing, so I'm speaking now in a way, say there was a system where I could, like I think it is in Israel, I just look at, and where it has been in other countries for decades, just look at what has happened with this patient before he or she came to see me, yeah? So, and like in summary, better healthcare, actually better outcomes, and leading to this, a reduction, a double diagnostics, yeah, just a better adherence to, I was just more on the way in direction of medical guidelines that doesn't apply here. yeah, I mean, I think that's a major thing, yeah, just to have transparency and information about the whole cycle of care. And that is also one of the main topics that I deal with in this whole, so a couple of you know that I focus on value-based care, right? And one of the key components is to actually look at the whole cycle of care. So the reduction in diagnostics is only, double diagnostics is only one part. We look at patients in like a small, like a second, right, in their care journey, and that doesn't make sense. So if data were to share between the sectors, and I think Nicola mentioned this before, specifically in Germany, it is traditionally so separated that no one knows what is going on in a different sector, and that is just really bad for outcomes, and only also sort of financially speaking really bad, right? Because many things are being done like redundantly and not according to guidelines. So it just makes, like, from a medical as well as a financial standpoint, which is what like the value actually means, so outcomes in relation to the resources spent for it, it doesn't make sense. Or to phrase it positively, it makes sense to share the data and to look at it from the whole cycle of care. So maybe let me stop here. Sebastian or Arthur, do you have a follow-up question?
One more question, Valerie, one more question before I switch to Sebastian. You represent the startup world. So what would be your postulate for the decision makers in regard to data sharing? What must be changed to move the things forward?
So I'm not the specialist into like deep detail of the regulation. I think what has to be changed is what I touched upon before, is to find a consensus that it makes sense and why it makes sense to exchange data, and to look at it like holistically, and to create immediate benefits is what Yuri said for everybody involved. So the patients, but also for the people who work in the healthcare system, right? So we have physicians and nurses and all these people. Like it seems like there's like more and more that we put on them, and what is their benefit, right? Their benefit should be that a patient maybe enters in their care better prepared, because I know what has happened to them, I know their history. I might even have some recommendations from my colleague that I can read up on all of these things. Yeah. So I'm more in the direction of doing a campaign, like Sebastian said. I think that the why needs to be discussed a lot more. There needs to be transparency, that we're still like figuring this out as we go along, and that we need everybody to work with us. That's really all I think that we need.
Thank you. Sebastian, please.
Okay, I try to make it dramatic again and go even further. It's what is the science of medicine? I mean, the science of medicine is like the knowledge of diagnosis and therapies, and get it together with the patient data, you know, and some symptoms, whatever he has. So it's all about data. If you come up to diagnosis and therapy, some data were collected. What is this? What is that? What happens? When is whatever? That's data. It was in the past data. It will be in the future data. So, but now we have a new option. We have a new opportunity to get data together from all over the world. So we can put on, like in the knowledge, we can put all the knowledge of the world about diagnosis and therapy in a big box. That's the internet or something like that, a cloud or something, and get all patient data and try to get it together. We'll have a perfect medicine. So yes, that's the effort of data in medicine. It will be the best medicine we can get. And so that's kind of the dramatic part I wanted to play on that.
Mm-hmm. Slowly, we have to wrap up our discussion. We have 7 minutes left. So the question is, for each of you, could you please name 2 or 3 critical actions that should be considered in Germany to get ready for the EHDS and to start sharing data and to inspire trust in data sharing among citizens? Who would like to start?
Wow.
I can. Okay, you go. I go.
No, you go. You have much
sorry.
more knowledge on the German
Yeah,
culture.
okay, you
and
said
healthcare
3
from me.
things. So I already have 2. I will make the third up as I speak. So I think, like, obviously the whole topic of interoperability, it's receiving a great push at the moment. but we need to agree that this like FHIR, SNOMED and LL.M, they are the standards that we will move on with. I mean, otherwise I can tell you from a startup perspective, we do this, right? We have FHIR, we have everything coded in LL.M. Like we cannot do like another turn here. If there's a standard, like let's move ahead with it. So that then, as always, I would say like really get patients/people on board, yeah, and related to the topic of we need to understand and make sure what the why is and the whole why do we have a European health data space? Yeah, what is it for me as a person? And as a third thing, just continue the good exchange. I think the inspiration that we get from Israel is just terrific. So who's next?
Wait, please.
So I would piggyback on one of your last points. I would for sure put patients within the process, not just as consumers at the end of the process, but be part of those committees, discussions, regulatory forums. Patients need to be part of that in order to ensure trust and also ensure the voices are heard, and really understanding what they think they need is they need to be part of the process. It's not just campaigns, it's about them being part of the process. Then it's much easier to do the campaign because you already have that almost embedded in the process. So I would say patient participation is key for trust. And as I said, it's about will. Everybody that has a will to share its data will find its way to share the data. I think, I didn't say that before, but I think part of what the Israeli success is bound to is that there was not real regulation in the beginning. No one knew how to regulate EHRs. It just happened because it was a necessity. So if we talk about regulation too much, it will take years. Just try and do it. Bodies that will want to do it will find a way within the current regulation, and of course, adjust as they come along, of course. But the two things is participation and just start sharing, even in a very stupid way, but just start sharing.
Ronya, please.
I agree completely with what we said. One other comment I have that maybe we see from Israel is that, and this is like focused on technology companies, is in Israel, we know that when we develop a technology, we're not developing it only for Israel, but we will have to go to the world in order to make a viable company. And although Germany is a large company, a large country with a lot of people, and you can make companies that will only work in Germany, I think especially when we're talking about AI and digital health, you want to be able to go further than just Germany. And when you look at sharing data and what can you do in standards, you have to open up and look beyond Germany as well.
Thank you, Ronya. Sebastian.
Yeah, I think we are on a wrong way in Europe. If you take the name European Data Space, that's the wrong name already. If we come to the idea of Israel, we have data access right. You know, that's wonderful. Make it constitutional. Make the data access right for medical data constitutional, and that's all we need. This is like the mandatory thing you have to take care of if you bring something up. That's the first thing you have to think of. Make it accessible. And if you have a space, it's very difficult. You need a door. How do you get in? How you make rights? That will be very difficult. And then after that, we have this. I think the standard is the main thing. If you have a good standard, we can exchange. And then I go with Yuri to say, make it usable. Make it usable for everyone, for physicians, for patients, for pharmaceutical companies, and just try to get them there. And you know, I didn't know that my car data I'm doing up is helping me out to not get into traffic jams. So I'm very pleased for that. And it's not my job to find these solutions, but if you make it accessible and usable for me, I'll take it, you know, and I will underwrite every free data, whatever it is. So I think, yes, we have to change a lot for me, and we have to change the culture, and we're not going to get there in 2 days. So hopefully we can learn from Israel how to start a bit differently and perhaps shorten a few years.
Thank you very much, Sebastian. Now I open the stage for the questions from the audience, and I would like to invite also Nicole and Yoel to join us at the final Q&A. And let me start with a question from my side, because I have the impression that we missed one issue. And this is a question to all of you, and I would like you to answer very briefly. What approach do you prefer in terms of data sharing? A full control over the data by the owners, I mean citizens, who, when and why process the data with an opt-out option, or a data donation approach, or a mixture of both options? What approach is better from your point of view? And I would like you to answer very quickly, very briefly, so we have a kind of a big image of what's your opinion.
So I will take that question. I think there's another question that needs to be asked. In order for data to be effective, to be usable, we need data from everyone. And I think this is a very important thing we have to understand when looking at, especially at medicine. If we rely only on consent and opt-in, we will have medicine that is relevant, the technologies that are relevant only for the people that opted in.
Yeah.
And this is a big thing. It's a huge thing. So we will be going backwards. I can't stress it enough, I think. So we need data from everyone. We want representation from everyone. And if we want representation for everyone, and we want everyone in, and we want all the data of everyone so that the medicine and technologies are relevant for everyone, we need an opt-out.
Personally, I share your view. So who is next? Uri, please.
I agree. Opt-out is a much better way of opt-in. I think even when I was part of the policy committees back when they talked about how to do it in Israel, we said opt-out should be the way, not opt-in. You should be transparent about what it means and everything, but give an opt-out, not an opt-in, because it's just hard for people because they don't see most of the people, thank God, are healthy. They don't see the need in the beginning, so they won't opt in, and you miss a lot of data. I have nothing really else to add up on this.
Okay, Valerie.
Opt out, to make it brief.
Okay, Sebastian.
Yeah, opt out for sure. And we already came there that organ transplantation should be an opt out as well, so we can transplant our data in opt out, I think.
Nicole.
Well, I agree with what has been said beforehand. And I think a very important point which has been raised is actually, regardless if we talk about opt-in, opt-out, whatsoever, the normal person on the street has to have the trust and the understanding what it is used for and what it can benefit him personally. And the trust, why I'm saying that, to give you an example, it's not trust increasing if, for example, the electronic health record is going to be launched and people would actually told by their GP at the moment, this is just set up in a way that you either give your GP consent that he can access everything on it. That means your GP or your dentist can actually see also if you go to a psychologist or whatsoever, or not. If people hear stories like that, they immediately go like, no, this is not a very comfortable situation. I don't want that. And that's the most important, regardless of opt-in, opt-out. This is a very important discussion for sure, but we have to involve the people on the street who at the end of the day are affected by that.
Yoel, what's your opinion?
So to be unique, I'll try to argue something different. I think you need to distinguish between secondary and primary use. If you talk about secondary use for research, then I would argue not even allowing to opt out. Health organizations should be allowed to use the data without asking patients. And I have, I think, a good example for why is it important. Currently, this is a real situation in Israel. We don't have an opt-out mechanism. Every health organization can anonymize the data and share it with researchers. And during COVID, because of the mistrust of government using the data, we tried to be more to go forward with being more ethical and more privacy controlling. And we said to the IRB committee, look, we're going to open up the database of the Ministry of COVID patients with an opt-out. And what that made is instead of building more trust in the ministry, it builds mistrust, because if you're giving me the option to opt out, maybe you're doing something not good with the data. Why to opt? You're not controlling it. There's the problem of privacy. So if there's a problem, I want to opt in. Like the IRB told us, like if everything is okay, don't ask us. If there's a problem with privacy and your anonymization techniques, then it should be an opt-in mechanism. So paradoxically, we ended this situation of saying, you know what, we don't want an opt-out. We're just going to do anonymization and give the data as it is, as it was till now. So, and secondary use, I don't believe in opt-out. I think it's just for lawyers, for letting us the feeling that we're doing something that benefits the citizens. They don't really care about it. It's just something that to get us feel good about.
Thank you.
If you talk about primary use, then I think we need to have also an opt-in, like not a mechanism to force self-organization to share their data. So it's not an opt-in. It's more of a giving the patient the right to give orders to health organization to share the data when they don't do it. It doesn't mean that they cannot do it without asking. They can share the data without asking me if they feel that this is can help my treatment. But if they're not doing it and I want my data to move from the one hospital to another, I should be able to give such an order.
Thank you, Yoel. We have a first question from the audience. Please, Nick Schneider, the floor is yours.
Thank you very much, Artur. Yeah, first of all, thank you very much for all this input. I think it's very relevant. I just wanted to put up a further statement, a bit following on your right now. I think the question often, if opt-in or opt-out is the right question, I don't think it's that necessary. I think it's necessary from a legal perspective, but from a user perspective, I think it's more relevant to have control. And I think in the end, if I have a good, what I usually call a consent management or a data release management tool or a data cockpit, which I can control if I want to release data for research purposes, for other purposes, for training of AI purposes, if I want to release it for certain users, being it just scientific research or also commercial research, or even for certain players out in the market, it doesn't matter if I opt in or if I opt out. In the end, it's a question where I put my tick boxes and how much control I want to have. And I think that's something which we should develop for the electronic health records as well, as how we can ensure that actually the citizen, him or herself, have control over their tools which they have in their hands when releasing data for certain purposes. But nevertheless, we will need to have, and there I'm totally with Ronya, we will need to have certain data available for certain purposes which need to be complete, because otherwise we will be using biased data if we only rely on data being donated or being released through opt-in or opt-out channels. I think this is something where we need to differentiate. And for those, and there I disagree with what Sebastian Vorberg said earlier, that we don't need regulation. We will need regulation to say this and this data use is legal in accordance with the GDPR, in accordance with national law, and that's why we don't need consent for it. And I think that's something where we need to be better in Germany also to actually have that legal clarity because of all the sensitivities we have for historic and other reasons in Germany. We have such a contentious use of data protection. I think we will need to give that legal clarity and certainty to the users out there to also gain trust. And I think that's where regulation should be there, not to inhibit innovation, but actually to give the right, I would say in Germany, I would use the word Leitplanken for innovation and research. And I think that's something which we can do better because we often tend to overregulate. And if I see the discussions we have with our data protection authorities, it's often about the nitty-gritty details which are not relevant. I think what we need is really to see where we want to be going with this. And I think that's where we, and there I agree with everyone, can learn a lot from Israel. And that's why I'm so grateful for GIHF-AI and what we are doing here and bringing those two worlds together to learn from each other, but also to collaborate. And that's something which I would actually ask you when I come with a question. Please see how you can connect between Germany and Israel and what concrete projects can come out of this project. And that would be something which would be a nice take-home lesson for everyone. Thank you.
Thank you very much, Nick. Hannah, do we have more questions from the audience?
Yes, I got one more. Let me see. So yeah, that question was actually expressing a little bit concern about some of the rhetoric regarding making mistakes. So the argument is, you know, health data are very private, are very sensitive, and so is making mistakes really something we can afford? Or maybe, Sebastian, I think you were the one being most passionate about it. Maybe you can elaborate a little bit on what you mean by making mistakes, and because I'm sure you didn't mean it in that way.
Yeah, it's thin ice for me, but I love to break into this because yes, we can always start with a problem, and we can always start with a fear, and we can always start with turning backwards and run away. But that's not the reason or the idea how we can solve problems. So yes, we have to face problems, and we have problems, if we face them or if we are anxious or not. We have to face them anyway, and we will have data leaks later on, and we will have cyber security problems everywhere. So yes, we will have all these problems, but I think it's better to have a good data medicine out there and having these problems and not even starting having problems, you know. That's really, so yes, I know. And if I talk to even my family or my wife, they said, oh, you all with your data and you want to have everywhere. I'm not sure, I'm a bit anxious, I don't want this. And I say, you know, I try to shout out there. I go to Google, I go to Facebook, I go to Twitter, to LinkedIn. And I always think the NSA is going to answer me someday. Yes, someday they want to come up to me and say, we know everything of you. And then I don't have anything to hide. And I'm so happy I can use all this. And you need to be a bit nosy and have to have a little idea of what you can use it for. But still, it's always better than to turn back.
Thank you, Sebastian. Now Nicole and then Valerie.
Thank you very much. I would like to add to this question one point. We need to see it from the other perspective. We ask the question, is it dangerous or is there risk if we share the data, the health data? We would actually also, or we have to ask us, how many health or how many lives do we actually lose by not sharing the data?
Yes.
This goes into medical, clinical trials, and so on and so on. I mean, I also come from life sciences. What we see there, we need to share the data, basic bottom line, to save lives. And the other thing, what I want to say, last point with the regulation topic, and this is, I think, in particular also a German point, we have to make us very aware that what we regulate today will not be 100 or German preferred 110% secure for any technology and innovation out there in the next years. But this does not mean on hindsight that we now should even wait a bit more, discuss even longer the regulation until we are absolutely sure. We will never have it 100% right, because we can meet from now on in 2 or in 5 years. There will be technology out there and innovation. We have not even thought about it today. So we have to create a regulation which allows innovation, which is flexible enough so that we also, last point, have not to meet again, for example, with the AI Act, when it then comes, and it for sure will come, have again to meet in 5 years and say, oh, now we need to maybe revise it completely because there are certain things included which we did not bear in mind at that time. So we need to be flexible when we regulate and always bearing that in mind.
Nicole, I think we were talking about a campaign towards the citizens, and maybe that's a great slogan for the campaign. How many lives do we have to lose if we don't share health data? Please, Valerie, your turn.
Yeah, I just wanted to actually support Sebastian's point in a way that I think everywhere, specifically in medicine and also on this topic, we have to embrace a culture of mistakes or failure. It's very normal, and it's even a necessity to move ahead. And so many innovations in medicine also are based on mistakes that happens. And it does not mean that we take this lightly. We say, you know, it doesn't matter, like, you know, data gets lost on the internet. It's no problem. Nobody's saying this, but it is a part of moving ahead. So I want to support this point.
Thank you, Valerie. Before I will ask you for a 1-2 sentence wrap up from the discussion, there is one more question from the audience. Karim, please.
Hi, thank you for the possibility. I'm in the field of big data, building a boutique data engineering consultancy. But before I was doing this, I was working with the district government in Bavaria. Now I'm going to come to the valuable point. And I was dealing with the Corona crisis. And in the Corona crisis, billions and billions and billions of euros have been wasted, have been burnt, without an effective and an efficient action taking advantage of the data available to create a counter-action plan. So meaning to say we would register data, but we would not digest it and come up with any kind of new understanding, knowledge, how to react, how to treat, how to behave with Corona. And so this meant, in practical terms, people would get COVID infected and they would stay at home until they get into a critical state of not being able to breathe, then they get rushed to the hospital. And if we were to accept this as the norm for the future, then any kind of crisis that hits us again is going to create the same backward approach. And that was actually the reason why I pivoted into big data, because I said that can't be the way how we deal with it. We have to immediately analyze the data on mass scale. We have to immediately be able to recognize patterns, and we have to immediately be able to inform the people and the population with some kind of proactive action plans. I don't see the future of health being in the reactionary. It has to be a proactive. And I think the COVID crisis is the best argument for all governments to recognize that you cannot repeat this kind of behavior twice. I don't think Europe will survive it, honestly, on an economic level. I don't think it would be able to survive it, and neither other countries can survive this kind of slow, incapable, ignorant in the sense of not analyzing the data that you have, fast enough reaction towards a crisis. So we have the possibilities with big data to analyze fast, recognize patterns fast, collect them. So, and we have to take advantage of them. That's my opinion. If we want to come up with a relevant strategy to deal with potential threats in the future.
Thank you, Kami. We have only 3 minutes left, so I ask you now for a final takeaway from today's event and your recommendation. Only 2 one-sentences for each of you. So please, Ronya, the floor is yours.
So I'll mention that I heard the phrase big data for the first time in 2013 when somebody charted how medicine used to be very clinical and experience-based, and then it became evidence-based medicine. And then he said, and now we are entering the era of big data. And I think we are still entering the area of big data. We're not completely there. We still have a lot of challenges. Evidence-based medicine is still what big data needs to give us. And we are still learning the technologies, the methodologies, the mindset, and discussions and are very important around it. But definitely, we need to learn to share data and use it properly for all of us, for the good of all of us.
Thank you. Sebastian, your turn.
All right, I'll try to make it quick. What I always think is there are reflexes that are wrong in our community. We have wrong culture on that. And people try to be politically correct to not harm anyone, not the physicians, not someone else out there. And I would say, no, don't be politically correct. Don't follow your reflexes. Be radical. If you have the opinion that we just shared here, that we need to share data. And I have a sweater where it's, share your data and it's red. And I try to make some actions on that. That's all you can do because there are many, many people to convince. But start today.
Thank you. Valerie.
Yes, sort of along these lines, I think it's the time for actions rather than words. I think we have all shared very smart words, and in like the quote you or the text you read from me when I said I think everything is there, let's just push ahead. I actually like believe this even more after these 2 hours, right? So let's collaborate, gather our knowledge. Now is the time to create the better future together with all that we have. It's all here. Let's just do it.
Nicole?
Yeah, I can just agree to that. I mean, let's really now tackle the challenges which you see in Germany, but also globally, you know, in particular in the healthcare system, but interdisciplinary as we really have them. And unfortunately, I have to say, I don't think that the challenges will decrease in the next years. So we have to work together, and we want to work together. We have to collaborate, we have to innovate, and this all in a timely manner to really now, you know, keep going. And I think Germany and Israel can learn a lot from each other. They can collaborate a lot with regard to each other. And I think there's a lot of room and interest, and also, you know, interest for innovation, in particular in the health area.
Yoel, please.
Well, there was a couple of statements in the conversation that we need to move fast and try to do quick things, not with too complex regulation. And actually, like 3 years ago, when I came to office, I changed my title from head of regulation to head of policy because of this atmosphere, trying to do a lot of things without too much regulation. I think we accomplished some achievements, but in the past half a year, I changed my title back to head of regulation. And I think like the next phase should be, if we want to really enforce standards and shifting the power to patients as because there's not enough will, as we stated at the beginning. So in places that there's not enough will, you need to have regulation. And like, I think this is the next phase of Israel to be more. This is why I talked about learning from Germany. We sometimes need to think more strategically on regulating the market and not just moving fast. So I think this is our next phase.
Uri, your final takeaway.
Sorry, I really like this discussion, and I hope this pushes us forward. I mean, also listening to people like Sebastian, like me, like other here that are pushing the envelope a little bit further is something that is good. And I think we're on the way. It will get there because it's almost inevitable. It's just a matter of how and when, and I hope it will happen faster and in a very efficient way. I wanted to just say that we talked about opt-in and opt-out before, and my last word is, if you look at the American regulation, in terms of opt-in, opt-out, in terms of the health and hospitals, they said you have to share. Unless you share, you're liable. And I think that's an opt-out for the hospitals in some ways. And I think that's the way. I mean, you have to share unless there are like 4 or 5 really critical reasons you can't. You just have to. And that will create everything else afterwards. It's just making it move. So thank you.
Now I pass the floor over to Carsten. From my side, I would like to thank you very much for a great discussion. Carsten, the floor is yours.
Wow, vielen Dank. Thank you so much to Daraba, Artur for the moderation, and everyone from keynote speakers to the panelists for this inspiring session. To summarize, I think it's fair to say, and some made it very clear, it's time for action. So we need strong leadership to apply regulation and transform the health system. We need to understand health data as a public good. And we need more and better patient-centered data usage, which means patients need to have access to data. Also, we need to make it much more convenient to share this data, probably with opt-out options, even though we had also other perspectives on that. And the EHDS needs to have a concrete regulatory framework, for example, FHIR standards, which should be mandatory, or even shorter. We need to achieve more interoperability by using available standards. We need to get people on board, and we need to continue and extend the exchange and collaboration between Germany and Israel. And this is what we're going to do. This roundtable's report will be published soon on the GIHF-AI website. And as it was said today, we need to communicate the benefits of data sharing much better, which means trust and transparency in the health system is a big challenge. So please use the opportunity and register today for the third GIHF-AI Roundtable on communication and trust, which will take place October 19th, also at 2 o'clock CET. Just to remind all of us again, we have the GIHF-AI annual conference upcoming end of November in Israel. If you're interested to participate, please let us know. And around this conference, together with our colleagues from the GINSUM project, so the German-Israeli network of startups and Mittelstand, we will organize a digital health delegation to meet the conference and also other opportunities to do a deep dive into the amazing Israeli tech ecosystem in the area of digital health. So again, thank you so much. Stay healthy, take care of yourselves and your beloved ones, and I hope to see you soon in person. And last but not least, again, big applause to everyone who contributed today here on the panel, on the keynotes, but also Leah and Hannah from our team here at ELNET, who did the moderation, the organization, and who will take care of the report with the policy recommendations. See you soon. Bye-bye.
Thank you. Bye-bye.